Hi, I am Rashida Hani. For the definition, parenteral refers to the injectable route of administration, and it derived from Greek words which is para and entron. Para means outside, and entron means intestine. This parenteral administration are other than oral route, and it bypasses the alimentary canal. Parenteral administration has some advantage. First, injection route is the fastest method for delivering systemic drug, especially in emergency situations. Second, it also provides fluids, electrolyte, and nutrition for those patients who cannot take food. Third, it provides higher concentration of drug to bloodstream or tissues. IV infusion also provides continuous amount of needed medication, and its rate can be adjusted either to provide more or less medication according to the situation.
I'm Isaac. My metric number is 057071. So I will explain about the disadvantages of parenteral formulation. First, the manufacturing process is complicated due to the aseptic technique. Second, pose an opportunity for bacterial infection to enter the body. Third, need a skill of administrations and can be very painful. Next, it also difficult to reverse the effect. And lastly, very invasive. Next is a parenteral rules of administration. First is intravenous, which is injection through the vein. Second is intramuscular, injection through the muscle. Subcutaneous, which is an injection under the skin. Intradermal, injection through the skin. Intraarterial, which is injection of the parenteral formulation through the artery. Intrathecal, involve the injection through the spinal fluids. Intracardiac, injection through the muscle of the heart. Next is intrasynovial, which is injection through the joint fluids. And lastly is intraarticular, which is injection through the joint.
Next, I will present about sterilization. Sterilization is a process intended to destroy or remove all living organisms. All microorganisms, including spore-forming and non-spore-forming bacteria, viruses, fungi, and protozoa, may contaminate a surface, a piece of apparatus, food, or biological culture medium, thereby constitute a health hazard. So, it is necessary for complete destruction or removal of all organisms for ensure patient safety. Sterilization can be achieved by steam sterilization, dry heat sterilization, filtration, gas sterilization, and sterilization by ionizing radiation. For steam sterilization, it is in form of saturated steam under pressure. The basic principle of steam sterilization by autoclave is to expose each item to direct steam contact at required temperature 121 degrees Celsius and required pressure for specific time 15 minutes. In this sterilization, the destruction of microorganisms is by irreversibly denaturation of enzyme and structural protein.
Dry heat sterilization requires high temperature and longer exposure time. The protein, which is enzyme, and the nucleic acid of the microorganism cell are denatured by oxidation. Dry heat destroys microorganisms by causing coagulation of protein. Dry heat sterilization usually carried out in ovens that use extremely high temperature over several hours to destroy microorganisms and bacteria. However, these temperatures are not suitable for most drug products. Dry heating is also not appropriate for aqueous solution and is most commonly used to sterilize glassware, oily injection, implants, ophthalmic ointment, ointment-based, and dry powder drugs. Sterilizing by filtration is to reduce microbial population of heat-sensitive material by removing microorganisms. Three major mechanisms of filtration are sieving, treatment, and absorption. Sieving is when a particle larger than pore size of the filter causes particle retained on the filter. Treatment occurs when a particle smaller than the size of the pore enters and lodges onto the cup of the channel. Electrostatic attraction causes particles the opposite in charge to the surface of the filter pore to be absorbed onto the surface. Depth filter is a thick fibrous that removes microorganisms by physical screening, treatment, or adsorption. Membrane filter is porous membrane with defined pore size that remove microorganisms by physical screening. Sterilizing grade filters are used in the treatment of heat-sensitive injection and ophthalmic solution. It is suitable for sterilizing aqueous and oily solution, but not organic solvent.
Hi, I'm Hazik. So I'm gonna explain about gas sterilization method. The active agent of the gas sterilization process can be ethylene oxide or another highly volatile substance. This process is difficult to control because the gas are highly flammable and it only can be considered if no other sterilization procedure can be used. The sterilizing efficiency depends on the concentration of the gas humidity, time of exposure, temperature, and nature of the load. This sterilization process is used mostly for the plastic syringe and needles. Let's proceed with the sterilization by radiation. This method is achieved by exposure of ionizing radiation in the form of gamma radiation, infrared, or high-velocity electrons. It is used mainly in the healthcare industries. This process used to effect the ionization of the molecules in organism, and it is used for heat-sensitive materials or products. Bacillus pumilus, Bacillus cereus, and Bacillus sphaericus are the bioindicator strains used in this process.
So for the next slide, I'll be presenting about sterility testing. The main point of sterility testing is to eliminate any viable microorganism from the parenteral products. Sterility testing must be conducted. Sterility testing is a procedure carried out to detect and confirm absence of any viable form of microbes in or on sterilized pharmaceutical products. It gives the confirmation that the products are truly free from any viable microorganism. The objective of sterility testing is for validation of sterilization process, to check the presence of microorganisms in the sterile preparation, and to prevent issues of contaminated product in the market. So for the method of sterility testing, there is two methods. The first one is membrane filtration method. Membrane filtration method is appropriate for filterable aqueous preparations, alcoholic preparation, oily preparation, and preparations miscible with or soluble in aqueous or oily. This method is performed aseptically in laminar airflow hood. The second method for sterility testing is direct inoculation method, which also called the immersion method. The test products are immersed into tubes that contain certain medium and are incubated for 14 days. This method is appropriate for materials that cannot be easily filtered.
In conclusion, it is more significant to produce good quality of parenteral product which are pyrogen-free liquids by a detailed investigation of sterilization methods. Sterilization of parenteral product are important before making final decision for the product release to attain the described therapeutic effect.